Huples cat. Just going to do something a bit fun. A long time ago I was in a pharmacist and I came across this, and at the time COVID-19 disease was spreading like wildfire in Wuhan, a city of 11 million in China, and there was a handful of cases in America. And I don't normally get these magazines, I know a lot of people like them. I look at them as entertainment, but I actually thought it'd be kind of funny to go through this at the end of October 2020, given the fact this was probably prepared and put together probably in the February, even March area, 2020. So it's what you need to know, Coronavirus Survival Guide, the latest on the deadly pandemic. And having read this was well worth the money because I'm not dead yet. But anyway, let's have a little look at it, shall we? First off, they got the surgical mask part right here. But this is kind of fun. Do people actually find this stuff entertaining? Like wandering around like that in a deserted city, not going to help you. As I've said before, putting on and off an N95 is not too easy and you have to practice it. Putting on and off an NBC mask is really difficult. Even an Israeli gas mask, if it's functional. Not contaminating yourself if there's virus on the outside of it, real tough. Don't recommend it. So there's contents in here, let's have a quick flick. This is Worldwide Outbreak. Everything you need to know. So it was kind of fun. They started with a beginning basic epidemiological section, which was great. I kind of enjoyed it. A death toll that grows daily, even hourly. Well, it's by the minute now, isn't it? This is the scene of the coronavirus outbreak in Wuhan, China. Is the US next? While the situation continues to evolve and more cases of COVID-19 are diagnosed worldwide, here's a basic overview on how the disease first began and how big a problem it might become. And this is pretty accurate. I kind of enjoyed this. Lots of little pictures in there and it tells you about what's going on and everything. On January the 1st, the Wuhan market was shut down by the government in Wuhan province. And yeah, that's how long ago it was. As of mid-February, more than 1,370 deaths and over 60,000 cases have been reported globally. Research suggests asymptomatic transmission is possible. Right? This is like, and it got lost somewhere along the line. Public health in my country decided they couldn't deal with asymptomatic transfer, so pretended there wasn't any. Basically true. It can take up to 14 days for the first symptoms to appear. Can. The interesting thing is, during that asymptomatic period, would you actually test positive to a COVID-19 test? So it's interesting. Perhaps Vice President Pence has COVID-19, but has had it at a very low level, so he's not triggering a positive result.
Good morning, Anthony. No, the White House said that Vice President Mike Pence will not change his campaign schedule because he is considered essential personnel. CDC guidelines say those people can continue working as long as they are asymptomatic and take precautions, but critics say campaigning is not an essential duty.
Campaigning in North Carolina, Vice President Mike Pence made no mention of the COVID-19 outbreak in his inner circle.
That's why you should avoid people who've been in contamination with people who've got it. The list of runny nose is a symptom that's mostly been debunked, except in really young children. Nice little diagram about how spread occurs and how rapidly numbers increase. They used the Lancet study that was done between January the 1st and January the 20th in Wuhan. 75% of the patients in that study had bilateral pneumonia. That infiltrates fluid on both their lungs. 17% developed acute respiratory distress syndrome, which is not a good thing to have, and 11% died of multi-organ failure, so approximate mortality at that time was estimated at 2% of all cases. So currently I think America is claiming 0.5% mortality, which is absolute garbage, but people like numbers that make them feel happy. The worldwide death rate percentage is quite clear, you can figure that one out. Ontario's actual death rate has dropped to 4.4% of all known cases, and 2/3 of them are elderly and sick. This actually claims at one point if you're fit and well you'll be fine if you catch it. That's not true. Fit and well people that catch this can and do die. The other thing that I think was really fun is they actually look at the difference of cases between influenza in a normal season and COVID-19, and you can see quite clearly influenza is the bigger issue unless you have COVID-19 in your area. And nobody's ever really argued that, but that got twisted into why are we so bothered about COVID when flu's fine. Interesting, I could go on with that, I'm not going to. It's pretty obvious why you're worried about it, and it's pretty obvious why every government, including socialist and right-wing governments, are pretty worried about it, except for one government. Maybe, yeah, one government. Okay, at press time, around 98.8% of the cases are in mainland China. However, there's been cases reported on more than 25 countries. I think now there's like about 7 Pacific islands that haven't had this. It's truly a global pandemic. To give you a little bit of information on past pandemics, I'd like to point out that MERS and SARS and Ebola have a much higher case fatality rate than COVID-19 currently does, and that's a good thing. We looked at crazy coronavirus myths, and this really is important because a lot of this stuff, months after this came out, is still circulating, and it's just garbage. The coronavirus is a bioweapon myth. There's no factual basis at all to support these claims. There isn't. So at that time of this, it's China's crisis. It's now everybody's crisis, isn't it? And we all saw what China did. Mass quarantine of anybody symptomatic or anybody infected or anybody that had been exposed. They took them away from where they would normally be and locked them up and wouldn't let them out for 14 days. And guess what? It works. The US, along with other countries, made a huge mistake. The US said it would deny entry to foreign nationals who have been travelled to China in the past 2 weeks, and they did. And some people complained about that, as some people complain about everything. However, they should have barred all travel into and out of China until the Chinese cases had dropped to almost zero. We in the West didn't do that. We were worried about cruise lines going bust and stuff like that. Talks a bit about cholera and Black Death and bubonic plague, all that stuff you need to look at. Talks about Spanish flu. Talks a little bit about stuff in Toronto in 2003 when we had the SARS outbreak. Me and Katie had the misfortune of working ICU and living through that period of time. We were in lockdown for months. We've been in lockdown for months again. I would never have thought that would happen. Gives you an improve your odds section, which I actually kind of enjoyed, but I have some issues with it. Bear in mind, this is pretty early on. Number one, limit your exposure. Yeah, don't go out and about. Don't go to restaurants. Don't go to movie theatres. Don't go to water parks. Don't go to your kids' school plays. Don't go to the mall. Don't be around other people. The virus requires people who are infected to be near you to infect you. It's not a good thing to be around people until we have a workable vaccine or it's worked its way through the population. Wash your hands, and it points out that soap and water is much more effective than hand sanitizer. It's basically a great idea. Touch your hands before and after contact, it's a good thing. Remember to keep your hands in front of you. Imagine if everything has got sticky red jam on it. So your sticky red jam, you're touching on the door handle or the chair. Wash it off your hands before you touch your face. Try not to touch your face. It doesn't really mention that in a large degree, but it does mention it. So distance, hand washing, avoid touching your face, cleaning surfaces thoroughly. There's arguments for that, whether it's actually necessary with COVID-19. This is where it gets it fundamentally wrong. Limit contact with people who are sick. No. You avoid all contact with anybody who is sick until you know they haven't got COVID-19. Unless you are paid to look after them, like I am, or unless you have no choice, but you have to look after them, in which case you have to be very careful. Somebody who has COVID-19 or might have COVID-19 has to be isolated from other people. You, generally speaking, have various levels of quarantining for yourself to avoid becoming an isolation case. You don't want to catch this, right? So you want to quarantine, avoid other people as much as possible until we have a vaccine. Okay, the false safety of face masks, and this is where we start to get some of this stuff here. So the standard surgical mask, it points out the truth. A standard surgical mask offers little to no protection for you if you wear one. Little to none. What it does do is it stops you infecting other people. So if everybody's wearing big masks most of the time, or all the time they're around other people, and those other people wearing masks, human-to-human transmission effectively drops to near zero. Not guaranteed, but near zero. So this is why wearing a mask is important. Why not wearing a mask around crowds says that you are dumb. Except it doesn't say you're dumb. I'm going to do a video on the psychology of anti-masking. And just to give you a tease for that, America. most of you guys and girls get it. Okay, spend time outdoors, get more vitamin D from sunlight, always a good idea. Get exercise, get fit, get rid of your paunch like I'm trying to do. Have a regular sleep schedule, still working on that. Having a lot of problems sleeping. I think it's stress from work and also stress from the dogs. Practice good kitchen habits, of course, but if you don't eat meat and eggs and cheese and fish, like I don't, you are actually fairly safe in the kitchen, though you can get salmonella and stuff like that and E. coli from vegetables, so you need to wash them under the tap. I don't recommend bleaching vegetables, but some people are. So again, micron size of masks, a N95 removes 95% of microns 0.3 or higher. So if you get an N99 or an N100, that's the better mask to wear in a heavily contaminated area. They are noticeably more expensive, and like the N95s, they're almost impossible to get. So to point out, these are all one-time use items. It doesn't actually go into recycling, but I will point that out again. I've been doing this for months. Any recycling of an N95 or an N99 or an N100 will not have a mask at the end of that process that's as effective as the mask was at the beginning. They are designed for single use. However, better to recycle a mask safely than to have no mask at all. So I'm able to wear N95s every time I'm at work around people, and I work in a hospital. I'm able to wear an N95 on all transit. I'm able to wear an N95 every time I go to the grocery store. Bearing in mind, I'm not going into those areas as much as I would normally do, and I'm boycotting being near people as much as I can at work. So bake them at 170 Fahrenheit for an hour. Keep them in a transparent glass or plastic box in the sunlight for a week before you take them out to bake them. The straps won't last very long. The masks will start to get contaminated by sweat and go orange and hard. Feel them gently. If you notice that they've got lumps in them, discard. And if you feel that they're really ratty but might be workable, put them aside and reuse new ones. So yeah, nothing is one-time use. Nothing in SHTF. So a lot of this was based on SARS in 2003, which is a coronavirus. It is definitely true that SARS-CoV-2 infection presents differently. It's much more of a slower spread, but it's much more of a resistant spread. And by that what I mean is most people that got SARS-1 were sick really quickly, were highly infectious, a lot of them died, and you could tell they were sick. This one, we have asymptomatic transfer. We don't know people are sick, and sometimes they never find out unless they've had a test done, and the tests aren't 100% reliable. And so it's slowly spreading through our population. And claims in some parts of the United States that there's 80-85% of the population are exposed to this are absolute hogwash. It's designed to fool you into going back to work. We have nowhere near enough people infected in any of the populations anywhere on the planet right now to actually allow herd immunity to be an actual thing. It's about 14 to 20% in the most hit areas of Europe, and that's by their multiple people studying how many. So when you hear reports that 80% of people already have it in New York, guarantee that's not true. It's certainly not something you want to risk your life on. Wait until Asia and Europe show similar figures, and then it probably is true. They talk about gloves. It's always useful to have gloves. I don't think you necessarily need them. Right now I have an ongoing skin issue from a skin tear, so I wore the gloves when I did some recycling today of the masks, because I'm not convinced my skin's intact, because it isn't. So if I'm wearing gloves at work, it's because of this, not because I feel I need to wear gloves at work. Gowns, you don't need these unless you're in physical contact with people. And it tells you how to take them on and off. It's all good stuff. Masks, I liked this. Cover your mask and nose with cloth, perhaps laid with a coffee filter or something similar. Anything you can do to limit the amount of contaminants that can reach your mucous membranes, the better. Now I will interject, SARS-CoV-2 really likes to get in the nose, infect people by the nose. Not so much the mouth, it appears to be the nose. That's why the nose has to be covered when you wear a mask. Again, it is far better from ideal, but it's better than nothing. And yet people are out there in crowds shouting and cheering and waving flags with no mask on because they've convinced themselves this doesn't exist. What you do when illness strikes. And while the virus is not yet widespread in the US, there were 15 confirmed cases at Preston. So for something that was very early on, this is actually great. And if you don't know much about prepping and you don't know much about infectious diseases, this is a really, really cool book. And I kind of enjoyed it. So it does point out that 10% of early cases, their only early symptoms was diarrhea and nausea. As far as I know, that's still true. They don't know when a person becomes contagious, and they don't know how long the incubation period is. That is still true. It appears to be about 5 to 7 days from time of infection, but it's hugely variable. In other words, all of these people might have it, and you wear a mask and avoid it. Okay? Talks about the symptoms, talks about postnasal drip, which we don't really think anymore. This amused me. Also, the surgical masks don't filter everything out. That's why healthcare professionals wear higher level protection with respiratory filters, as well as surgical shields or goggles. Indeed, we would. Indeed, we did in SARS-1 in 2003, but unfortunately we don't have any N95s, and even in October of the pandemic's first year, we still don't have adequate supplies of N95s to routinely have hospital staff in a major teaching hospital in Toronto wear them in the emergency department when interfacing with patients. If we think they might be presenting with COVID, we shuffle them aside, and then maybe the people will be wearing N95s for a bit. We have had this week a case where somebody was positive for COVID, who was just a regular emerge patient. There was nobody triggered that they were COVID, and they were actually assisted on and off the washroom because they had diarrhea by support personnel in the emergency department who didn't even have a surgical mask on. And we wonder why there's 8 hospitals in the Greater Toronto area today with outbreaks, including mine. Facts, fiction. Most people's prepping comes from fiction, and you can tell that. Talks about Outbreak, not a great movie, I didn't enjoy it at all. Contagion, okay movie. Few things wrong with it, it was alright. And talks about a book and stuff like that. Talks about preparedness checklists. Talks about bugging out in a pandemic scenario. As we all know, bugging out was something nobody really did. Talks about security. That's something I think we're all wondering about. Talks about what you should do if you're going to hunker down and stay in place. Pretty much in most pandemics you're probably going to be doing that. But this is one, they made a major miss here. Stock up on your disinfectants, stock up on your water. You don't really need water if the mains are working, but yeah, okay. Communications, well, the electricity's on most places, though I think California's having troubles, but I don't think that's pandemic related. Look at that. Anal retentive storage, excellent. Talks about hygiene. Yeah, I had a lot of this stuff before this pandemic started, so I don't really need to stock up on stuff. But didn't mention toilet roll, and they, like me, missed out on the great toilet roll bonanza. Talks about first aid. Kits like this are okay but pretty expensive. What you should be stocking up on foods and stuff like that. We'll point out to you, these magazines do this, all these tomato products like pineapple in tins will not last very long at all. It rots the tin. If you can have tomato, have it in glass. Okay? It's an acidic food. And peanut butter, after 2 years, is rancid and you can't eat it. You can try hunting with it, I guess. Standard American diet, that's why Americans are all fat. Talks about dehydrated, freeze-dried. Tells you what to do if you're bored. I think we've all had to face that, but I think the thing is, what we didn't appreciate was being bored in a pandemic is a funny thing. You are terrified and frightened and insecure, so you don't actually have the energy to self-entertain. That's what I've been finding. Huge stress on me. Talks about bugging out. This is where it gets into generic stuff. They obviously had ideas for the thing and then just turned them around and made them for the pandemic issue because, well, it's trendy in China. Hey, let's go and do it. Prepping with children, what you should do for kids, don't have them. They're a huge liability in SHTF, as are pets. But anyway, we love them, so we have them. Tells you what to do about them, so this is generic, not related. This turned out to be very straightforwardly related to the pandemic, though I don't think they mentioned it in the pandemic parts earlier on, is debt. And that's going to be the major consequence of this pandemic, is economic downturn for the next 2 to 4 to 5 years. It's going to get worse and worse and worse. When the stock market crashed in 1929, it wasn't really until the end of 1930 to the beginning of 1931 that the systemic and massive effects on the majority of people really got felt and was felt hard. So what we're going through right now is a false sense of yoo-hoo, because the governments around the world, most of them, are dolloping debt cash at people to try and keep the people happy, and not starve and not lose their homes. And people don't buy that things aren't going back to normal, that this is actually a crash. And having the Dow so high is actually a fundamental problem with the psychological ability to understand what's actually really going on, which is a massive dislocation of the world's economic trade and stuff. Keeping cash on hand, well, obviously it's a security risk like getting stolen. I actually had quite a bit of cash on hand when this all broke out. So during February and March, I was able to do a lot of food and other supplies stock up using cash. What I didn't anticipate, and which none of us really anticipated, was the fact that a lot of places by now won't take cash. My grocery stores won't take cash. Use a debit card or a credit card or you ain't got no food. So that was an interesting factor. But you are in Socialist Canada, but it's their store, they can do whatever they want. He also had a bit on emergency comms, which is always fine. Talks about under quarantine. The premise is simple. Nothing comes in, nothing goes out. Yeah, that's a premise, and as they point out, who's going to be able to do that? I don't know. This magazine uses stock photographs from Google, by the way. Just so you know. I kind of enjoyed it. It talks about lockdown, talks about making a sick room. None of it is in enough detail for you to actually do any of this stuff safely, but it's like a teaser. The will to live. The important to conquer your negative emotions and thoughts when faced with medical and physical adversity. It is, but just remember, terminal is terminal and we all die, right? So don't go around being falsely jolly to people that are terminal. Let them be. Talks about a disaster on vacation. That happened. They used the Princess Cruise Line to base the article around. Talks about medical insurance, stuff like that. Now I just want to talk about this because I'm going to go on in a different video on this. Beware of normalcy bias. It's a mental state in which people underestimate the dangers they are facing in a disaster, causing passivity and inaction. Don't act like everything is normal if you're in a crisis. In a life or death situation, seconds count. Act quickly and get yourself to safety. Yes, but also normalcy bias is also manifested in aggressive refusal to understand or believe that there is in fact an SHEF occurring. And that we've very much seen in a minority of preppers. And the magazine finishes off by talking about hurricanes and wildfires and tornadoes and floods and all that kind of stuff. So I don't recommend this magazine at all. I can't even remember what I paid for it. $13 Canadian, I think. Total rip-off. But it gave me some amusement when I saw it and read it, and it gave me a lot of amusement now. It's kind of fun. They got about 98% of it bang on, and I thought that was really impressive because a lot of people I know online got about 98% of it wrong, and it's interesting to see how that turned out. Anyway, feel free to give me a subscription if you'd like to see more content from my excellent channel. Feel free to send me your firstborn, and feel free to give me a thumbs up. Toodles.